Coray, hi, and thank you so much for joining me here on Faces of Digital Health to discuss physician burnout, what the research says, what KLAS Research found so far. So KLAS Research is a healthcare-focused market research and insights firm that specializes in evaluating and reporting on the performance of healthcare technology vendors. You have the numbers behind the trends related to burnout, and in your role at KLAS, you oversee the research operations and strategy for clinical research teams focusing on how health technology impacts delivery. So welcome, and tell me a little bit more about KLAS, the research, and what kind of you find most insightful in your work. Let's start there.
Yeah, no, well, thanks for having me. I'm excited for this conversation today. KLAS is, I think KLAS is a little bit of a weird company, kind of a very unique culture. We've been around for coming up on 30 years. So in 2026 will be our 30-year anniversary. We have historically been focused on kind of vendor performance, how they take care of their customers, how the software is working, in the real world. We do interviews. All of our stuff is done by interviews that way, and just to understand, but mostly with executives. That's what we've done primarily throughout the years, has been really talking with healthcare executives about their experience with their vendor and their software. Back in 2017, we started what we call the Arch Collaborative. So we had done usability research where we talked to like CMIOs and various folks and kind of clinical leadership about what the usability of their systems was like. But then we would go and we would talk to like an end user clinician, and their feedback would be somewhat different than the leadership, because the leadership would look at it from an organization and say, look at all the things that we're able to do with this, and this is helping us, and we're getting better with it. And oftentimes the clinicians were more frustrated. The end user clinicians were more frustrated. So we knew there was some level of disconnect, and so we wanted to see if we could figure out how to get that end user clinician perspective, and see what we could learn. Really, as we started the Arch Collaborative, it was really more an experiment of what are we going to learn. We thought we were going to tell EHR vendors what they needed to do differently to make their systems better, and we have learned some of that. But really what we've learned is we've talked with and interviewed or surveyed, I guess, end using clinicians, both nurses and physicians, is that the execution around the EHR is probably the most important thing. So, what EHR you're running isn't as important as how you're functioning as an organization around that EHR. Mm-hmm. So it's been really fascinating to get there. So KLAS's whole purpose and what kind of motivates us is trying to help the industry get better, right? So we've worked with vendors trying to amplify their customers' voice so that they could see what was most important and act on those things that are most important to their customers. With the Arch Collaborative, we've kind of stepped into health systems now, and we're trying to amplify the voice of their clinicians so that they know what levers they need to pull that are most important, that are going to impact the experience of their clinicians with the EHR.
When you say that you're talking to clinicians and decision makers such as CIOs, CMIOs, how big is the pool of people that you talk to, that you do research with? How diversified is it based on markets? So do you primarily focus on the US market? How do markets compare in essence?
Yeah. So we have been, we started out in the US, it's probably been 12 years or so ago. We started doing expanding into the international markets and doing research in various areas around outside of the US, primarily focusing on the EHR use outside of the US. And so we do roughly at KLAS probably 25 to 30,000 interviews a year with leadership around the experience with the vendor and the software. On the Arch Collaborative side, it's different. Like I said, we work with specific health systems, and so we we do surveys deep inside that specific health system to understand it. And from each of those health systems, we'll get anywhere from, a few hundred to a few thousand responses back on that. So the Arch Collaborative data, I think we're probably pushing 700,000 data points at this point. And internationally, let's see, what did we do last year? I'm just going to add this up really quickly. So probably about 30,000 data points, roughly internationally, maybe a little bit more.
Mm-hmm. At HIMSS Europe, you had a presentation on burnout. So let me just try to find the data that you shared there. So this was really interesting. So in essence, you compared burnout by region, which showed that the Middle Eastern clinicians reported only 20% burnout, whereas, for example, in Europe or the US, the percentage was much higher. So how do you see this data? What does it tell you? Why is it so different in that region?
Yeah, the Middle East has been a really unique place. So as you look, you can see that around the world, by and large, outside of the Middle East, it's pretty much, we're all right around 30 to 35%, right? So that median line there is the US burnout. And so you can see that there's nobody that really stands out as having the kind of that culture that's helped burnout outside of the Middle East. In the Middle East, it's interesting because as we've measured them in the Arch Collaborative, they have some of I think they probably have four or so out of the top six highest performance levels in the Arch Collaborative all come from the Middle East. And so they just have a very unique culture. In fact, I bumped into at one of the user conferences, I bumped into a CFO. I was just sitting by him on the bus riding out to the conference and kind of interviewing him. He said, yeah, he recently moved he was actually somebody from Australia that had taken a job as a CFO in the Middle East. And I'm like, well, how have you liked that? And he was like, he goes, it's crazy. He goes, it's the most collaborative place I've ever worked. And I'm like, what do you mean? He goes, well, I came into my office the other day and there were like 4 physicians sitting in my office waiting for me. And I was like, uh-oh, this is going to be bad, right? They're going to be frustrated with me. And actually what they did is they just sat down and said, hey, we know we can do better. How can we work together so that things are going better for all of us, right? And it was very much a collaboration. And he's like, I've never seen that any of the other places that I've worked. So I talked to one of the other organizations. They just kind of have a culture of trying to be excellent with the software that they're using. I talked to one of the organization that has the highest mark in here, and I'm like, well, what do you do next? And they rattled off like 12 projects that they had in place where they were actively trying to make things better, right? So they kind of have this collaboration where they communicate with their clinicians, and their clinicians see that the teams are actively working to make things better and better for them. And we've run into that on a pretty regular basis in the Middle East. And the thing that really stands out to me on this is not only do they have the lowest percentage of reporting burnout, but the light blue on this chart here are actually the percent that list the EHR as one of their contributors. It's not always, it's almost never the only contributor, but they have the fewest numbers listing the EHR as a contributor to their burnout. So if they are burned out, the EHR is playing a smaller part in that. It may be other things that are facilitating that or driving that burnout.
Mm. As you mentioned, the culture is very specific, and the same way as it's ungrateful to compare healthcare systems because they differentiate, because the culture is different, and you can't just take one good practice and implement it in a different context. What does, the insight that you got from the Middle East tell you about other countries or other institutions? Because there's obviously a difference between having a private institution where you can afford to have the best technology, you can afford to get the best doctors, you can afford to motivate them and to really focus on the experience, versus, say, public hospitals or larger institutions where you maybe do not have the luxury to just give as much attention to the experience and dealing with the workforce, especially with the workforce shortages. So, what kind of reflection comes to your mind when thinking about these issues?
Yeah, well, and all very valid points, right? So all the organizations have very different circumstances that they're functioning with. But the thing to keep in mind with burnout is that most of the things that you need to do for burnout don't cost a lot of money, right? Some of them do, but not everything that it does. It's really around I mean, what if you look at it at the core of burnout? What's driving that is they feel disconnected and not disconnected from their organization or their organization's leadership, not listened to and not heard, right? Not listened to, not heard is kind of the key things that drives burnout. And then on top of that, you've got, you talked about their staffing shortages, right? And all that sort of stuff, and financial pressures to do more. So all that stuff kind of compounds on top of itself. And so if you're not heard, and not not listened to and not communicated to, all these other things get even worse, right? So you can't take those other big industry pressures away, but you can function around your clinicians in a way where they feel respected and heard, versus just like, for lack of a better word, mules to be driven, right? That you just have to get a job done and there's a certain amount, and you just have to do it. And I think the culture is changing. I know when I first came in to KLAS 16 years ago, it was really common as we talked with IT leadership that they would just say, clinicians will never be happy, right? That's just kind of what they just complain. And I think that's kind of gone away. I don't think that that's necessarily the case. They may say that about a few of the disciplines in there, that they say these guys will never be happy, but for the most part, I think that we have some momentum within healthcare across the world, where we know if we can do things right, if we can work together, that we can actually make things better. That feels like that is starting. That's part of what the Arch Collaborative. We had no idea when we first started this what we would find out, right? We really didn't. In fact, the very first survey that we got back, right? So we got the results back, we presented them, sent them over to the CIO that was like the first brave soul that sent the survey out to his clinicians. And his response back to us was, boy, how depressed should I be? Right. And at that point, we just didn't know. We didn't know anything. Well, all we had was that one data point. And turns out that organization, the fact that this guy was bold, wanted the feedback, was an indication of kind of the culture that they had created there. And they actually still have one of the higher scores that we've ever seen in the Arch Collaborative, right? So they were actually doing very well. They were at the top of the pile. But that's really at the crux of it is listening, communicating, and working, and feeling like there's some collaboration with them. And that's one of the reasons why, the EHR is not the cause of burnout, right? That's been proven over and over again, that the EHR is not the cause of burnout. But the argument that I would make is that the way that your organization functions and supports your clinicians in using the EHR, because it's like in most organizations that have deeply adopted technology, the EHR is kind of at the heart of what most of their clinicians do, right? It kind of guides their documentations, their interactions, where they get data from. And so how you function and the way that you support that and the way that you communicate changes and help people be successful with it is a great way to listen, to make them feel listened to, and also and make them feel like you are working with them and that you care about them, right? On how you treat them around the EHR.
Mm. Another thing that you also shared at HIMSS was exactly this, the fact that implementation is key to success. It's a known fact in healthcare IT. But I guess, the question that spurs out here is how does your findings around burnout and EHR impact vendors? How much do they take those findings into account? Because even though implementation impacts the EHR satisfaction, um, it's we can't just say that technology isn't a problem, because in some cases technology is a problem, and you do need to change the way that things are designed.
Yeah, well, and yeah, you're absolutely right. And I feel like we're kind of at a demarcation point in healthcare, right, where we now have technology that's starting to be introduced that is really for the clinicians, right? So as you think about the EHRs were largely built as data repositories. That's kind of how they started organization, and so the organizations that have adopted an EHR and are using it very well. Oftentimes, it's very good for the organization, but it's been done in a way that hasn't necessarily had the physician or the clinician, the nurses or the physicians at the heart of what it was trying to do. It basically put tasks in front of them. And by and large, we moved a lot of the things we were doing on paper, and we just moved those into an electronic format, which was harder for a lot of clinicians to actually be able to interact with, right, than paper. So if we got rid of some of the, like the crazy scribbles that, you had to decipher. I remember as a nurse, when I first started out, we were on paper and you'd look at some of these things and you had to have context to understand what was written there, to be able to decipher it. And then sometimes you just had to call the doctor and say, okay, what were you really saying here, right? So all that stuff has gotten better because of the HR, but it's largely put obstacles in the way. And you're right. I think that that we're the technology needs to change, and I think AI is at the point where we're going to start to change it. In fact, we've seen the impact of some of the ambient speech. So in the Arch Collaborative, I think we've had 25 or so organizations that have done before and after ambient speech measurements, kind of to look at the impact of the clinician experience. And almost universally, the ambient speech has had a positive impact on their burnout, on their experience with the EHR, the way they feel about the quality of the technology, so the vendor that's producing technology, and as well as how their organization is delivered. So it's one of those things where everybody is it's a win-win for everybody.
I'm glad that you mentioned ambient speech. You're based in the US, and the market there in terms of ambient is very, very vibrant. A lot of strong players, fierce competition, and now increasingly it seems that ambient is going to become a commodity. So we've saw the announcement that Epic is going to roll out its own ambient system. One of the vendors also kind of rolled it out for free, if I'm not mistaken. So how do you see the changes there, and maybe the broader impact that this might have on the whole experience and the development, inclusion of AI into EHRs?
Yeah, and I think like I said, we're at a point where things are going to change, and if I were smart enough to say exactly what was going to happen, then I'd be a very rich guy, right? We'd make a lot of money off of this. But everything's changing. It feels like we're moving away from. I think we're moving away from we've kind of moved from a keyboard to a mouse, and I think we're probably moving from a mouse to voice is likely going to be the way that we're interacting, and it's going to do a lot of work for us in the background. So. With Ambient right now, it's primarily being used in outpatient setting at this point. There's a few organizations now that are doing some initial tests on the inpatient side of things. It's been almost exclusively physician used. And there's a lot of work going into and some early adoption that's happening around nurses using it as well. And I think it's gonna help. And right now, it's really basically scribing notes right? So it's helping to create the note, taking off some of that cognitive burden of having to go in and create things, create recreate the visit. But I think that we're right at the cusp of it really taking next steps where it starts to automate. Okay, you said you were going to order this, so now it's going to key up and start to order, have that order ready for you. So instead of you having to go in and put it in, that's going to be sitting there and you're just going to have to approve, yes, this is what I wanted to do. And I think the systems are going to become much more smart assistants to the clinicians versus kind of where they have been, which has primarily been a taskmaster, right? This is their compliance thing. You have to put this in to get the billing covered. You have to put this in to cover yourself from a legal standpoint, right? All those types of things. And I think it's going to shift to where it's going to start helping us say, okay, look at this, or have you thought about this? And read a lot more, because there's so much data out there now that a clinician can't, there's no way they can get and read through all of the information and assimilate that into making that decision. And I think that's what AI is great at, right? So that's going to go and start to look at the whole patient even more and give little cues to the physicians and nurses to get them to think about or notice things that they may not otherwise.
Mm-hmm. Before we move into the whole insights that AI and large data sets can bring, the overwhelming amount of information that the clinicians have about patients, I do want to go a step back to the research that we saw 2 years ago, or even more years ago, when the discussions around burnout started to surface. At that time, a lot of clinicians said that because of the experience with the EHR related burnout, they are very likely to leave their job within 2 years. I think that was actually KLAS Research.
Yeah.
Do you have any follow up on that? Is this changing because of AI, because of Ambient? What kind of trends are you noticing?
Yeah, and like I said, so the research on that is early. We've had 20, like I said, 20 or so that have done before and after, and we've actually seen that burnout has dropped. So with Ambient, it's interesting. So we know, we're confident that it's from the Ambient that has made the difference, because we looked at the data, and the folks that were given Ambient had a higher percentage of burnout. So they kind of targeted some of these clinicians that were not doing as well, right? And so their burnout started out higher than those that were not using Ambient. And then what happened with the before and after is those not using Ambient, their burnout stayed flat, right? It was not impacted. So there weren't other things happening in the organization that were driving burnout down. That burnout stayed flat. But the burnout, in fact, let me make sure I've got the right numbers here. Yeah. So the burnout, reported burnout from those using Ambient dropped 12%, right? So it's a significant amount that dropped. And then their feelings around how well they felt about the EHR and how well they felt about their organization, and really how you feel about your organization is a big part of your burnout. That also, both of those went up. So it was, it's pretty, I think the data is trending towards the right direction right now. Again, we have macro industry problems with the shortages. We've got all the baby boomers that are going to start needing more and more care, and we have fewer and fewer clinicians to take care of them. That's always going to be a problem, and we're going to have technology. It's a good sign, because we're going to have technology help us solve this problem. We're not going to be able to throw enough people at it to just solve it.
Absolutely. I just thought of a question that I'm not sure you are going to have the answer to, but when you mentioned, the decrease in dissatisfaction with the introduction of Ambient, I wonder how that would differ between the existing clinicians that went through the version 1 of EHR systems, the clinicians that went from paper to EHR, and then the new clinicians that are hardly entering the workforce and perhaps don't even know what to expect from EHR systems. And the reason I guess I'm thinking about this because one of my favorite quotes from one of the EHR vendors is still that they don't compete with other vendors, they compete with paper. So, paper is the fastest thing, just to scribble something on a post-it note compared to going to 3 drop-down menus just to make sure that the data you're going to input is going to be legible. So do you have any comparison in terms of, the age groups or the different different age groups, generations of clinicians and how they're experiencing technology and the impact it has on their work?
Yeah, and it's been a while since I've looked at that data specifically. I know initially what we found was that the the satisfaction with technology was not as stark as we all went into it with the assumption that people my age, right, that had been on paper and now they're being forced into this EHR world and are coming up on the years where they're getting closer to retirement, that they would just be like, this is not for me. I'm going to hate this no matter what. But we did find that typically those that are used to technology adopt it much easier, right? It's just kind of you don't have to overcome as much with them. But it wasn't as stark as we had originally thought. So those that were a little bit older and had more had a longer on-ramp to technology were a little less satisfied, but not as dramatically as you would have thought. So, but I do think you bring up a good point. I think we're getting to we're going to have a population of clinicians that are going to get to the point where they've never used anything else, right? They're just going to expect it. But what we see is that even with every EHR, right? So the same EHR, we'll hear clinicians go from one organization to the next and say, this is not the same as it was over here. My experience over here was better, or my experience at this new place is way better than it used to be. So we're going to see pressure as folks expect the technology to work at a very efficient level and be done that way as people move around. I think that pressure is going to just increase. And like you said, I think Ambient's going to become a commodity. All of that sort of stuff is going to be kind of the new baseline. And it'll be interesting to see if some of these big changes that we're seeing in the clinician satisfaction, is that a honeymoon? Because it's such a drastic change and they're like, oh my gosh, I don't have to click through 12 things anymore. It just kind of puts it in there for me. Is that going to be a honeymoon thing? And then they're going to go back and I think that's likely going to be the case, is they'll get used to this is the new normal. And then other things that were not as important to them before, that were maybe a nuisance, are going to continue to need to be refined, right? So, but the definition of progress is really just discovering new problems, right? You get past one problem, you find the next one to tackle. So it'll be an ongoing thing. But like I said before, I'm excited about right now. I think we're at the cusp of healthcare changing dramatically over the next few years.
Absolutely. I agree. There is one thing that I wonder. Do you have any predictions on or anticipations around what's going to be the next thing that we're going to need to be mindful of when it comes to understanding the satisfaction and the way the technology works in healthcare? And what I mean by that is that, with the rising amount of data and the introduction of algorithms, the whole understanding of how the system works is diminishing. So the trust is increasing into these systems, which is not a problem until somebody tries to question the results or the conclusion that a clinician came to. So that's kind of where I potentially see the problem. Just drawing from the examples with United Health in the US and the claims for rehabilitation for older patients that were designed by algorithms, and when caregivers or patients were trying to understand, like, why did they get a certain number of weeks for that rehabilitation, they really didn't get an answer, and more importantly, there was nobody that they could turn to. So, this depersonalization of responsibility, how do you potentially see that in the future of EHR design, assessment, and satisfaction scores?
Yeah, and I think what you're bringing up is something that the industry is concerned about, right? And kind of why we've started with, by and large, lower stake, lower risk, I guess is probably a better word for it, areas like with the documentation, right, and helping with those types of things, is that as the trust grows, the scrutiny put on it, that, and we're doing some interviews right now about some of the ambient things, and pretty much everybody says, hey, they're getting much more accurate, but you still have to read it and make sure, because it will still, sometimes put something in there or interpret something that was said incorrectly. And so you have to put your eyes on it and some thought on it. The other thing I've heard that clinicians say is that sometimes they feel like they don't know the patients as well after this. So they get the information they need right up there in front, but that cognitive effort that they had to go through before to remember what had gone on, actually write it down, that cognitive process helped them remember what was going on with the patient more, versus then having it all in there, reading it, making sure it's correct, and clicking go. So there's going to be give and take with all of this sort of stuff. But I think that I think we'll figure that out, right? That's going to be a matter of repetition, process, watching things. There's, we all talk about, the fear of AI doing something wrong, right? And somebody not catching it. But we do stuff wrong all the time right now, and people don't catch it until it's too late. And, the hope is that AI is going to do stuff wrong less often. That's not going to be caught less often than we are doing it right now. And I think there's probably a reality that the human error probably outpaces the algorithm error. But that remains to be seen. But I think, like I said, I think from a satisfaction standpoint, that unless something gets to where they just can't trust it, right, that the clinicians are going to continue to look to this to increase their efficiency. And right now they're looking at it to give them back a little bit of their life, right? Not necessarily just to see more people, but they're talking about, I get to go home and have dinner. I get to go to my kids' soccer game or something along that lines. That those little things make their life better. And again, that's going to contribute to their burnout and their satisfaction with their job and the organization they're working with.
Yeah, absolutely. It definitely sounds insane that they would need to sacrifice all the things that you just mentioned. And especially with the younger generations, we also see that they're not necessarily willing to give away too much of their personal life just in order to do their job. So hugely important for sure.
Yeah, and I actually love that. I think they're teaching us the right thing. I think too many of us have let our careers and our jobs kind of suck the life out of us, as opposed to having it enhance our lives and really make our lives super rich. And our personal lives, I think if those aren't rich, it doesn't matter what you do in your business. If you're making gobs of money and your personal life is falling apart, that's the wrong trade, at least in my book.
Absolutely. I love the quote. The only people that are going to remember all the long nights that you did 20 years ago are going to be your kids. So
Yeah.
that's a good guiding principle, I guess, when it comes to just trying to at least balance work and personal life. Coray, is there any specific research that KLAS is about to do in the upcoming months, in the upcoming year, that you think might be worth keeping an eye on? When do you expect you're going to have any new insights?
Yeah, well, we're always collecting more and more insights. So as the ambient, there's more and more that's happening around that, right? And so we now have both within the Arch Collaborative, we're collecting lots of data and getting more and more organizations that are getting that. So we'll continue to put that information out, and it'll be really interesting to see what the impact as that ambient takes the next step to helping with like orders and coding and all that sort of stuff, especially in the US where, the coding and all that stuff drives so much of the revenue. If it can help with all that stuff and have some more downstream effects on the health, the financial health of a health system, I think that's going to be interesting to watch. And then we'll stay right on top of all of those things. We are doing what we're calling ROI research now to go into organizations and say, okay, you've put this in, what ROIs have you actually been able to get from this? And so we're trying to collect and understand that, we've done a little bit of that within the Arch Collaborative, just asking them about, as you're investing in the clinician experience, not just even in Arch Collaborative, but in the clinician experience, what impact are you seeing? What ROIs are you seeing back? And they're starting to listen to that. So with the financial pressures, the ROIs are becoming more front and center. And so I think we'll be doing a lot more around the ROI of what's happening and helping organizations see what they should be getting from their software. So I think you can watch for that over the coming year.
Do you have any tips in terms of what kind of KPIs organizations should set themselves in terms of measuring success? Because it's sometimes very hard to compare before and after state because the data sets aren't comparable, especially if you go from full-time monitoring of something, basically from paper to full-time monitoring with software. So any tips in terms of that?
So your adoption of software overall and kind of your use of that, health systems have become better at watching those because you're really watching, like, are you getting your quality metrics? Is your quality going up, right? Are you you're closing more care gaps? You're doing more preventative things versus just being in a completely reactive mode. You can kind of watch those types of things. I would say the caution that I would put out there, at least from what we're hearing back from folks around like Ambient and some of this automation, is there's a temptation to say, okay, look, to pay for this, we're going to have you see more patients, right? And most of there was only we've done some research with some early organizations around this to ask their clinicians, say, do you want to see more, or would you be willing to see more patients around this and because of this? And I think 80% of them have said, we really don't want to. No, at this point, because you've got folks, you think about it, you got folks that are kind of burned out. They want their life back, not more productivity. But I think that will shift. I think that'll happen naturally as people become kind of settled in and they're like, okay, I know what I can get done now. Yeah, I can take another patient or two each day because I get a little bit more money. It's better off for the health system. All that stuff works together for the good. But I think right now forcing that versus letting it happen more organically is probably not the right thing to do. I know there are some health systems. I talked with one at our global summit that just said, we need if all of our doctors in our trust saw one more patient a day, we would still be behind. Right.
Yeah.
And that's, so they just said, we're using this as an incentive. If you want this, you got to see one or two more patients a day. And they're like, we don't have a choice. And I know there's some situations that are like that, but by and large, letting it grow more organically is probably going to be a better approach for the health, mental health and of your clinical staff.
And I think that's a really great point because with any technology and any software that we can use. And we can see that, even outside of healthcare on our personal basis, with the learning curve of using new AI tools. In the beginning, it's very daunting. The learning curve is steep. It's not pleasant to learn something new. You don't necessarily go into it with the idea of doing twice as much as you did before, but once you master that, it just becomes natural, and it also becomes less stressful in that sense, because you don't think from the get-go, oh, I have to do 3 times as much as I did before. So that's a really good point, I think.
Yeah.
Yeah. Okay, well, Coray, thank you so much for sharing all the insights about KLAS, about the KLAS Arch Collaborative. Let's hope that, the physician satisfaction and the workforce satisfaction only improves with technology, because we sure know that the healthcare needs are not decreasing anytime soon.
Yeah, very much so, very much so. And I think the one thing I would just put out there to everybody is that if you focus on it, you can make a difference, right? So if you focus on the clinician experience, we have seen over and over again that things will get better. And we've also watched that if you just get busy and you think, oh, I'm going to do that later, I'm going to do that later, oftentimes you don't get around to that, right? So what you focus on gets your attention and gets your efforts and gets better, because, we have a lot of just very talented people in healthcare. If we can get them to, give them time to focus and energy to focus on this stuff, they'll find it super satisfying, and they'll actually get to see the fruits of their labors as their clinicians start to come to them and notice what they're doing, and how their life is changing. So
Thank you again, Coray. Indeed, leadership is key.
yeah,
So thank
yeah.
you.
All right. Thanks so much. Thanks for having me.